we are going to a village called Igbokofi in Yewa axis of Ogun State. We hear that this village does not have a working primary health care center.
She delivered, but because of bleeding, we lost her. She bled to death. And of course, could there be Silifa and then Ugunyomi, Maria? So we lost them. These three are just three out of many again.
Are you saying
this is the primary health center?
Ìgbà tí a dọ̀hún, wọ́n ní ilé ọmọ mi ti ya already.
ìyàwó ọmọ tèmi gangan tó fẹ́ bímọ báyìí tọmọ tóyún inú yẹn ló kú.
Unfortunately, this is what is remaining of the primary health care center. Here in Igbokofi, Ogun State, the boundary community between Nigeria and Benin Republic.
Igbokofi is one community out of hundreds, I'm sure even thousands of communities in the entire Ogun State. And the way the primary health service is structured, one primary health center is meant to serve 10,000, a minimum of 10,000 individuals.
Igbokofi is not a village. It's a community of villages. It's a community of villages. And if you look at this, you would think that government, either Ogun State government or Nigerian government, mean that this place is at the international borderline, should have everything they needed. But no, is the answer. The unfortunate thing is that in Towe, Benin Republic is just behind my house here. In Towe here, they have a primary health center. Once they know that a patient is coming from Igbokofi, from Nigeria, they triple the bill just to push them in. And people, of course, they have to return back home and fall into the hands of untrained, unqualified nurses and doctors, quack. No test, nothing. They just put something and they just prescribe drugs. They don't care whether you die or not. So simple and little sicknesses and illnesses and diseases that shouldn't have taken people's lives happen to be a stepping stone for death to come.
The World Health Organization says that every community should have a primary healthcare center because it's an essential part of any healthcare system and can address 80 to 90% of a population's health needs. However, people living in Igbokofi, a community in Yewa part of Ogun State, have no such understanding of that statement. For years, they have been abandoned by the government, having only a decaying building where a few items remain as proof that it was once a healthcare center and now a place where villagers go to defecate and vote. And this has led to the death of many women there. We went on a fact-finding trip to truly investigate the state of the primary healthcare facility in this village.
This is baby's cot. This is baby's cot. See. This is baby's cot. See. Wow. This was the labor room.
What year?
This was the labor room.
What year was it last effective?
Last effective, I think, 2008.
2008.
2008.
Toilet is old.
No. The place is large. That's big enough. This was the toilet.
So if this structure is what's left for residents to access as health care, how do natives access care in Igbokofi, a community of villages with a population close to 10,000 persons, particularly the pregnant women of Igbokofi? We spoke with Folake Olaniyi, a member of the village who lost her womb due to lack of a primary health care facility.
Ìgbà tí mo ní oyún, mo lọ sí hospital. Táìmù tí mo padà délé, mo ti lóyún, èmi àtọkọ mi la wà lọ́hùn. Ìgbà tí mo wá ní ìlàkọjá yẹn, mo fi padà wálé pẹ̀lú àwọn ọmọ mi. Ibi náà mo sì dé, mo ṣe lọ sí hospital ní ọ̀dọ̀ wa ń bí báyìí. Mo ń lọ, mo ń bọ̀. Ìgbà tó wá tó táìmù tí màá bímọ. Nǹkan tí màá kàn rí ni pé ìgbà tó tó táìmù tó yẹ kí ọmọ jáde tí ò jáde, ara ti ṣe ń ni mí. gbò mi tí ẹ mọ bí mo ṣe wà rárá ajá ń bá kinní yẹn lọ títí gbogbo around 12 o'clock òru kódà mi tí ẹ mọ bára ṣe ń ṣe mí mọ́ ìgbà tí ó sáfẹ́ bọ́ sí bí ó ṣe yẹ kó rí àwọn dòtó yẹn tó tún pera wọn wá péjọ sí ọ̀dọ̀ mi ní labour room wọ́n ṣẹ̀ṣẹ̀ náà tí kò gbà ìgbà tí ọmọ òsì jáde èèyàn ti ṣe nǹkan tí wọ́n fẹ́ ṣe gbogbo tí ò ti rí bẹ́ẹ̀ wọ́n ní kí wọ́n máa gbé mi lọ sí ìjò wọ́n wá gbé mi ní aago kan òru tó mo rántí táìmù yẹn dáadáa aago kan òru ni wọ́n gbé mi kúrò nílẹ̀ àfi lọ sí ìjò ẹni tó tẹ́kì ẹ̀mí ń bẹ̀ òun náà tún try agbára ẹ̀ títí tí wọ́n fa omi fún mi pé bóyá táwọn bá fún mi ní drip ọmọ yẹn á lè jáde wọ́n sá try yẹn títí ilẹ̀ fi mọ́ ìgbà tílẹ̀ wá mọ́ ni dókítà yẹn wá kéèsì pé kò sí ẹ̀jẹ̀ mọ́ lára mi ẹ̀jẹ̀ ò sì dànù ní táìmù yẹn kò sí ẹ̀jẹ̀ mọ́ náà ní láti sọ fún mi pé ẹni táwọn ní kó wá ṣiṣẹ́ abẹ yẹn ní òun ò sílé pé wọ́n máa gbé mi lọ sí Ayétòrò àsáàdé Ayétòrò ní ọdún náà bá a ṣe dọ́hùn yẹn náà wọ́n gbé mi wọ ṣáátà láti bẹ̀rẹ̀ iṣẹ́ wọ́n tún pé ẹni yẹn again ó lóun ò sí around láti lè wá ibi tí ọ̀gá hospital bẹ̀ yẹn tó ṣe dìde ó sáré lọ ra ẹ̀jẹ̀ níjọ́ yẹn ẹsẹ̀ lásán ló fi ibi tó lọ tó bá ní tó bí sí tọwé mi lè mọ ibi tó lọ ṣùgbọ́n ẹsẹ̀ lásán ni máa yẹn ó fi traka tó sá lọ níjọ́ yẹn wọ́n lọ ra ẹ̀jẹ̀ yẹn wá wọ́n wá sọ fún mi inú mọ́tò lẹ́ni nǹkan tó ṣẹlẹ̀ ni pé mi ì ní lè dúró sí Ayétòrò yẹn pé ká máa lọ sí Láǹtòrò Abẹ́òkúta bàbá yẹn náà ló sá gbé mi pẹ̀lú káàlì ọdún yẹn ẹ̀gbọ́n ọkọ mi lọ́kùnrin wọ́n dúró tì mí ní táìmù yẹn pẹ̀lú ìrora mi ì mọ̀ bóyá láyé ni mo wà àbí ọ̀run ní táìmù yẹn ṣùgbọ́n kíní yẹn le fún ọ̀tá mi ní táìmù yẹn débi pé mi ì mọ nǹkan kan tí mò ń ṣe mọ́ wọ́n ṣe àwọn iṣẹ́ kan fún mi ní Ayétòrò yẹn ní táìmù yẹn mi kọ́kọ́ rántí tẹ́lẹ̀ ni wọ́n ní àwọn ò lè jẹ́ kí n gbé ọmọ yẹn lọ wọ́n fọ́ọ̀sì ọmọ yẹn jáde ní àyè ìgbà yẹn ọmọ yẹn ti jáde láyé ọmọ yẹn ti kú already wọ́n sá fọ́ọ̀sì mi ṣe níbẹ̀ ní wọ́n á gbé mi pẹ̀lú bí mo ṣe rí wọ́n gbé mi lọ sọ́hùn ìgbà tí adọ́hùn wọ́n ní ilé ọmọ mi ti ya already pé ó ti fàyà ọmọ yẹn bí tí ó ti ń ṣe wàhálà àti jáde pé ilé ọmọ yẹn ti yà tàbí káwọn rán inú lọ́hùn kan tó wá rán ìta ìwọ̀n ní nǹkan tó jẹ́ kí kinní yẹn kó ní mi lára òun nìyẹn.
Kunle Gab, Folake's pastor and a resident of Igbokofi, detailed other examples in the village and explained further the story of Folake.
As touching the issue of the case of Folake Olani, it actually happened in 2017. It was an evening like that I was called that Folake was into labor, and when I got there, I thought it's going to be a normal delivery like others. Unfortunately, it wasn't. By 7:30, 8 o'clock, it became an issue whereby all the untrained, unlearned, unprofessionalized equipment were used on her by these untrained nurses and doctors that we have around, all because we have no government facility around us. Mind you, Igbokofi is a unit of Ijohun ward that has more than 9,000 eligible voters. At least registered voters of Igbokofi is 9,000 plus. Even though the people around here are not 9,000. Of course, we have close to 50,000 people around here. If you look at all the communities under Igbokofi, Igbokofi is not a village. By the time they'll be taking Folake out of Igbokofi, the head of the baby was out, but she couldn't push. The baby refused to come out. So she was taken on the lapses of her brother-in-law because her husband has disappeared into the blues, She was taken on the lapses of her brother-in-law to Ijohun. At Ijohun, the private hospital in Ijohun refused to attend to her because they were afraid. They referred her they referred her to General Hospital in Ayetoro. You know, this place is under Yewa local government. They refer her to Ayetoro. By the time they will be getting to Ayetoro, it was during this there was a doctor strike then. So thank God that one doctor came into the hospital that day, just to come. The guy just came. It was the guy that briefly attended to her and referred her again to Abeokuta. So it was Abeokuta that they performed the surgery. And of course, unfortunately, she lost her womb in the process because the womb has been ruptured. Damage has taken place because of the longevity of the labor and all that. And this is just one out of many. Just one out of many. Thank God that we didn't lose her. As we lost Tosin Ayeni. Of course, that one even delivered. She delivered. But because of bleeding, we lost her. She bled to death. And of course, could it be Silifa and then Guyomi Maria too? We lost them. These three are just three out of many again. Because there is no government presence here. And mind you, the unfortunate thing is that in Towe, the Republic is just behind my house here. In Towe here, they have a primary health center. Once they know that a patient is coming from Igbokofi, from Nigeria, they triple the bill just to push them away. And people, of course, they have to return back home and fall into the hands of untrained, unqualified nurses and doctors, quack. No test, nothing. They just put something and they just prescribe drugs. They don't care whether you die or not. So simple and little sicknesses and illnesses and diseases that shouldn't have taken people's lives happen to be a stepping stone for death to come.
To be clear, the World Health Organization stipulates 1 doctor to 600 people for a functioning healthcare system. But for Igbokofi, this is not so. In 2020, over 80,000 Nigerian women died due to pregnancy-related complications in Nigeria. A UNICEF report released in 2022 revealed that Ogun State recorded the highest number of children's deaths in the southwestern part of the country. The survey, conducted by the Nigerian Bureau of Statistics in collaboration with UNICEF and other partners, indicated that Ogun recorded the highest figures in neonatal mortality, infant mortality, and postnatal care for newborns, among others in the region. The situation here shows how these statistics come about. Folake is not the only one affected by this. Idowu Bangbose spoke to us about the death of his daughter-in-law at childbirth.
Idowu Bangbose mo sì jẹ́ ọmọ bíbí Igbokofi. Ọsibítù ó jẹ́ ẹ̀dùn ọkàn fún wa torí pé nígbà mìíràn lóru bí nǹkan bá ṣẹlẹ̀ a rìn lọ bí máìlì 2 sí 3 nígbà míì ká tó dọ̀hún nígbà míì ọmọ yẹn ó lè ti dákẹ́. Kódà ìyàwó tọmọ tèmi gangan ìyàwó ọmọ tèmi gangan tó fẹ́ bímọ báyìí tóyún inú yẹn ló kú kó tó di pé àìsí ibi tí a lè máa rógùn gbà déédéé kò sí ibi tá a lè máa rí oògùn gbà tàbí ìtọ́jú tó péye kò sí ni. Ó ti tó bí ọdún 2 sẹ́yìn tàbí sí 3. Nígbà yẹn sà ọ̀rọ̀ yẹn ó mú wàhálà lọ́wọ́ sà o. Kódà ó tiẹ̀ fẹ́ gba èmi gan tí mo jẹ́ bàbá ọkọ ìyàwó. Torí náà ni pé kò sẹ́nìkan tó dá sí àwọn ìlú ọpẹ́lọpẹ́ ìlú ló ràn wá lọ́wọ́ tá a fi lè ṣètò ẹ̀ kò ìtàn náà dì sí bá a ṣe ń wì a kàn ń fi ọgbọ́n náà ṣe ni.
We asked to put a face to these statistics, a picture, something that brings reminders to these women. We were told flood has robbed them of some sacred memories, a people detached from civilization and the benefits of it. We had the wife of the community leader share the plight of women here.
Nǹkan tó ṣẹlẹ̀ ni pé àwa obìnrin a máa ń struggle láti lórí àwọn ọmọ tó bá jẹ́ ìsàn ló dé fún wa tá a bá ti dé French à ní lè rògùn bẹ́ẹ̀ bá
ìyẹn
sọ
Benin
pé
Republic ní
bẹ́ẹ̀
French.
ni bẹ́ẹ̀ bá sọ pé àwọn fẹ́ lọ rògùn nǹkan tó yẹ kẹ́ rà ní 2000 ẹ rà á ní bí ẹgbẹ̀rún 5 ẹgbẹ̀rún 10 ń gbà mí abẹ́rẹ́ lásán bẹ́ẹ̀ bá fẹ́ gbà bẹ́ẹ̀ bá ti débẹ̀ ẹ ní lè gba abẹ́rẹ́ ẹ ṣẹ̀ṣẹ̀ máa wá wọn kiri ni a ní ìjìyà gan lórí ọsibítù lọ́dọ̀ wa ó bàdì gan ó bàdì àgbàlagbà náà tó bá jí nǹkan bá ti kì wọ́n ẹ ṣẹ̀ṣẹ̀ máa pè wọ́n ní bẹ́ẹ̀ bá ti lọ sí French ẹ lọ sí Jòun kẹ́ ẹ tó dé Jòun ṣẹ́ mọ̀ ìgbà míì aláboyún fẹ́ bímọ bó lè ti nira ń tán tánná kẹ́ ẹ tó gbéra wọ́n á débẹ̀ wọ́n á sọ pé kò ṣeé ṣe mọ́ ó máa di iṣẹ́ abẹ wàhálà dé nìyẹn ọ̀pọ̀lọpọ̀ ó ti kú lọ nítorí ẹ̀ pàápàá.
ṣe lè dárúkọ ṣàmọ̀ wọn láàrin ìlú ṣán jẹ́ èèyàn táwọn èèyàn dá mọ̀ ká máa sọ pé ọmọ lágbájá èèyàn lágbájá ìyàwó lágbájá báyìí báyìí.
ìyàwó bàbá Bámgbóṣé ìyàwó ọmọ wọn ó ṣẹlẹ̀ bẹ́ẹ̀ ẹ̀ ó ṣẹlẹ̀ bẹ́ẹ̀.
àtìgbà wo lẹ ti ń gbé ládùúgbò yìí báyìí tí kò dẹ̀ sí hospital táwọn èèyàn ń lọ kò sí ná báwo ni irú nǹkan bẹ́ẹ̀ yẹn ṣe ń lọ tẹ́ẹ̀dẹ̀.
ó ti pẹ́ ó ti tó bí ọdún 10 nísìn ìgbà tálàájì ti kúrò ń bí àti bẹ̀ẹ̀ sí jìyà wọn ọsibítù bẹ́ẹ̀ bẹ́ẹ̀ àwọn ọsibítù kéékèèké tó sì wà àwọn náà ń gbìyànjú ṣùgbọ́n kò dàbí àrà ẹlòmíì tó kọ́ṣẹ́ wọn ò fi bí ṣe légbé ẹ̀yìn odò ní omi ó ti gba ọ̀nà ìgbà míì tẹ́ bá lọ pè wọ́n á sọ pé kẹ́ ẹ̀ ṣẹ̀tọ́ gbé aláboyún yẹn kẹ́ ẹ̀ gbé kọjá odò ńgbà míì kẹ́ ẹ̀ tó dé ọ̀dọ̀ wọn ìgbà míì tẹ́ bá lọ pè wọ́n omi náà lá dá wọn dúró kí wọ́n tó débí wọ́n ń tíráyì ṣùgbọ́n kò dàbí pé kíkan wà ní ọ̀dọ̀ wa.
But is this the whole story? Could a government truly leave its own people to suffer without intervention? This was the question that led to the discovery of another project built by the National Boundary Commission in 2004, but never treated a patient till today.
The National Boundary Commission built hospital as part of their 5 projects. We'll get there, you'll see. And the project was handed over to the state government. And the state government refused to take it over. Let's just take it that this place collapsed. Why can't they go and put that one to use?
Is that one is
It's
not
there.
used?
It has never been used. This is a 5 project in one, built by National Boundary Commission. This is the first one. That's the police post. There's the police post. That's the workshop. We have a workshop here. This is the workshop. So this is the market, rather. This is the market. Beside it is the workshop. Beside it is the workshop. Beside it is the workshop. This is the hospital. This is the primary health center built alongside with the other 4. And this other one is the school. It's a 5 projects in one. Now, like I told you the other time, when that PHC collapsed, this is supposed to have been taken over. The keys and everything was handed over. Of course, all these projects, all the 5 projects were handed over to the Ogun State government. And I think that, of course, when that PHC collapsed, this is supposed to have been taken over by the state government since it has been handed over. Now, let's go. This is the reception. This is the reception to the hospital. As you can see, of course, of course, see the windows as of course imagine.
Sorry, sir. This one was built before that one.
This one was built before that one collapsed.
Before it collapsed.
Before it collapsed. And handed over to the state government. Before that one collapsed.
You said this was built or handed over to the government, to the Ogun State government in 2004. Yeah. 2004, 2014, 2024. That's 20 years.
Yeah.
It has not been used for a day.
Yeah.
And the structure is still up.
Yeah.
Okay. Is the police station in use?
Yeah, the police station is I don't know how to actually qualify it.
Are there
but
police officers?
There are police officers there without batting. They have nothing to defend themselves. Instead of not talk of defending the community.
So the people that are posted here, are they community members of?
They are not community members, so they are correct Nigerian police armed.
And they post people here.
They post people here. There are 3. There should be 5 there. But of course, they have no batting. Quote me. They have no batting.
Not too many persons know the story of the fallen health center like this man, who worked as a security guard at the health center many years ago.
Bẹ́ẹ̀ sẹ́ńtà yẹn kọ́kọ́ bẹ́ẹ̀
gan-an ó ṣẹ́wà dáadáa ìyá ilé kan lọ́kọ́ bẹ̀rẹ̀ iṣẹ́ ìlú pẹ̀lú ìyá Fatima gba bẹ̀rẹ̀ iṣẹ́ yẹn kò sí kọ́mpì gbogbo ẹ̀ náà olóyún bá dé olóyún abiyamọ bá dé wọn gbàtọ́jú dáadáa láàárẹ̀ bá dé wọn gbàtọ́jú dáadáa kò sí wàhálà kankan kò sí ìṣòro títí ìgbà tí kí náà fẹ́ happen àwọn ẹ̀jẹ̀ kan wá wọ́n ti ìjọba rẹ̀ kó oògùn wọn dáadáa fún gbogbo ẹ̀ gbàyẹ̀ fún àwọn kìnìún kílósì àwọn ẹ̀jẹ̀ ní máa ń balẹ̀ jẹ́.
àwọn ẹyẹ kéékèèké bat wọ́n máa ń yàgbẹ́ sí ní.
wọ́n yàgbẹ́ sí ní sílì yẹn.
inú sílì yìí yẹn lókè.
ìgbòmíràn já wálẹ̀ ìbọ̀yá ni ìjọba kó oògùn wọn yẹ fún gbogbo kìnìún kílósì àwọn yàtọ̀ bẹ́ẹ̀ sí wa nítorí oorun yẹn ti burú jù àwọn yẹn ń ṣẹbẹ̀ ní sẹ́ńtà nọ́ọ̀sì ń ṣẹbẹ̀ nígbà sùúrù gangan ló ní ọ ní sùúrù ni o oníkọ́ ní sùúrù ni kò sí ìbọn yẹ wọn gbé ìyá Fatima àti ìyá ilé kan wọn padà wọn tá gbé ọmọ kan ìyá Sunday là ń gbé ọmọ ìgbókùlà ìdíyà wọn tó gbé wa tó bẹ́ẹ̀ jẹ ọkọ ayẹtọ ṣiṣẹ́ bẹ́ẹ̀ títí ọjọ́ lọ ọdún méjì ọdún mẹ́ta wọn yàtọ̀ gbé padà kò sí wàhálà wọn sì ń bímọ láyé àti àlàáfíà kò sí fún kíkà ṣùgbọ́n ìbọn ayá èyí kì í ní ìṣòro ẹ̀dẹ̀ wọn dé bí dókítà bá gbé mi ọwọ́ bó bá ní o kò lè gbé nílé tínú o lè gbé nílé tínú yìí o nǹkan kó dá padà kó bá ṣe ṣe wọn ṣe sọ láàrin wọn parí ẹ bẹ́ẹ̀ ṣe ẹ̀tọ́ gbé oògùn náà wà tó fún ọ ní ìdíjàkejì o bọ́yá ṣe léwọ̀n tán gbogbo nǹkan lọ jókòó dáadáa náà ní aṣàtúnṣe gbogbo ẹ̀ wọn lọ́nà bá yá aṣàtúnṣe gbogbo sẹ́ńtà yẹn ṣùgbọ́n tọ́tà ní ìṣẹ́ gbogbo tẹ̀dé láàrin ẹ̀ ṣùgbọ́n tọ́tà ní ìgbé èdè kò sí ìṣẹ́ kò yá mọ́.
We headed to Abeokuta to meet the Commissioner for Health in Ogun State and know the government side of the story.
Igbokofi is one community out of hundreds, I'm sure even thousands of communities in the entire Ogun State. And the way the primary health service is structured, one primary health center is meant to serve 10,000, a minimum of 10,000 individuals. So the structure of PHC is one PHC serves 10,000 individuals. So you can have, in my village, my one PHC serves 70 villages. That's because in each village, there's not up to 100 people in each village. And where are you going to get, that's the structure, international standard, 10,000 people. So you'll find in Abeokuta South, one PHC will serve a smaller area because you can get 10,000 people. And you cannot go against international standards. We're being watched by WHO, UNICEF, and we are held accountable. We're accountable, we're transparent.
I asked her if she has ever visited Igbokofi as at the time of our visit. It occurred to me that her team seemed to have been around, but Igbokofi may still be hard to reach.
I personally have been to Yewa. I've gone on a 3-hour road ride, gone on a boat, and after getting to the other side on a boat, got on an Okada to make sure that I reach the furthest part of Ogun State, the primary health center. And I went with my team, the executive secretary for primary health, because we wanted to know where the problems are. I do not sit in my office. I go out, I'm on the field. I've been to Odeomi, I've been to Abigi, where you can't get into those villages unless you cross into Lagos. I left my home on a Saturday morning and at 7 a.m. and I didn't get there till about 12 noon. And I got, and it wasn't in a Jeep, it was in a truck. Yewa is a hard to reach terrain, number one. We find it hard to find qualified health personnel from the Yewa extract to actually work in their own PHC. What I believe is work-life balance. So you work where you live, and you're more likely to be vested in your own people. I am Ogun State. Why did I come back from England? Because I feel connected to my people. I want to make a difference to them. So we try to recruit. We can't recruit people. it's hard to reach. I can't force someone whose family is living in Abeokuta to go and live and work in Yewa. It is not fair on them. We do try as a ministry to ensure equal distribution, but I have pleaded with the local government leaders, traditional leaders, give me qualified people that I can train from your community. Sponsor 5. Right now, if you go to our School of Midwifery, we have 5 individuals from each local government that has been sponsored by the local government chairman for us to train as a community midwife. I've just chosen 6 local governments that I'm going to ensure that we have a focused maternal emergency transport system, which means that when women go into labor or they have any obstetric emergency, they can call for free and we pick them up. I picked Yewa North and Igbokofi. Those are the 2 local governments that I picked. So I'm aware of their remoteness. I know that they're hard to reach, the terrain is poor. I can't get staffing, so we've done our best for Yewa.
Before we close our case, we move to speak to medical experts in the state. The former chairman of Nigerian Medical Association Ogun State and a resident doctor with Federal Medical Center, Abeokuta, agreed to shed light on the emergency state of healthcare, particularly in remote Ogun communities.
It is very important to note that majority of the reasons why people go to hospitals are treatable at the primary healthcare center. It is now where the level required in managing a particular disease, especially as they become complicated, or in some cases non-communicable diseases that require expertise, that you then go to the secondary healthcare center, which are the general hospitals and the state hospitals. After the level of the general hospital or state hospitals, cases that cannot be handled or require higher specializations are the ones that go to the tertiary health facilities. At this level is not where malaria is treated. And the aberration that we have now, having so many people going to federal medical centers, teaching hospitals like LUT, UCH, UNTH, the teaching hospitals in the north, anywhere in this country, with symptoms of malaria is an aberration. They are not supposed to be there. They are supposed to be treated at the primary health centers. But by the by, there is still a big problem. Nigeria requires much more than 30,000 primary health care centers.
Yes, the concept of primary health care, PHC, is supposed to be the first level of care in the health system, and it should provide healthcare services for individuals at the grassroots in the community, where individuals can find healthcare at their doorstep. The healthcare services is supposed to comprise the component of preventive, curative, rehabilitative, and so on and so forth. And this should be, despite the fact that it's a PHC, primary health care, it should be quality as much as possible. Talking about, as I mentioned, the preventive care, which involves health education, curative type, which involves treatment of disease and providing solution to particular ailment. For example, treatment of malaria, follow-up for hypertension and diabetes and other infectious and non-infectious diseases. Also, the service should encompass rehabilitative service where the capacity is available. Nevertheless, if the capacity is not available, or if at any point of providing services, they cannot afford or provide an expertise, that kind of cases can then be referred to the secondary healthcare facility, where experts are available to provide solutions to such kind of problems.
One could say for every child born and alive in this community, it is nothing short of a miracle. But what are the odds of these miracles in a functioning state with polling booths but no amenities? The people are in need of healthcare emergency intervention, and the women are fighting to stay alive, one childbirth at a time.
Àbíjọba ti gbàgbé wa ni àbí kí ló dé, ṣùgbọ́n a kàn nírètí pé bí a kò tí ì kú ìṣe kò sáì ṣe kí ni ìṣe kò tán, wíwá tẹ́ ẹ wá bí lónìí ó jẹ́ ayọ̀ wa lọ́pọ̀lọpọ̀ tẹ́ ẹ bá lè bá wa ṣe tí ọsibítù yìí bá dúró ẹ rí i pé ọkàn ìlú gan á balẹ̀ ọkàn àwọn ọmọ wa tá à ń bí gangan ọkàn wọn á balẹ̀ pàápàá jùlọ bí ara wọn bá fẹ́ gbóná ó mú dààmú bá wa lóríṣiríṣi ọ̀nà ṣùgbọ́n ayọ̀ wa ó kún tí ẹ bá lè bá wa bójútó ọsibítù yìí kó di odindi padà sípò ọkàn wa ó balẹ̀ gbogbo nǹkan á ṣe kí ni á wà dé.
ẹ̀sìn ọlọ́run fún ìṣe 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 alálẹ̀ Igbokofi á fún ìṣe Jésù Olúwa wa.